Good afternoon. It is 12:02, and in the interest of time, we will start this presentation. I see over 200 people or over 250 people already logged in. I think this is perhaps the first of the Zoom series of Doc Talks, which we are doing, and I'm so glad so many people are attending. Our topic is very pertinent to today, which is fear and anxiety during times of Corona. My name is Asim Shah. I am a psychiatrist, and I am Executive Vice Chair and Professor of Department of Psychiatry, Baylor College of Medicine, and I'm also Chief of Psychiatry for Harris Health and Bental. Today, we are going to talk about fear and anxiety during times of Corona. And we all know there is a lot of fear, there is a lot of panic, there is a lot of anxiety. I will try to limit my presentation to half time so that we can answer your answers also. And we have some questions already. Next slide, please. So right now, what is happening, if you all know and see, we know that the disease is big. We know this crisis is huge, unprecedented. We have never had anything like that in our lifetime, and hopefully never will. But the panic seems even bigger than the crisis. And something to understand that some panic, of course, is normal. We all get panicky, and we get more panicky and anxious when we have a fear of something which we don't know, meaning fear of unknown. Anything which is unknown causes more fear, causes more anxiety, and causes more panic. At this time, some panic, some fear about this crisis is absolutely normal. Why? Because this is something which is unprecedented. This is something which is spreading the whole world on a global scale, and the panic is going to be there. But what is the difference between having some concern and having concern which is out of norm, which is taking over us? We all can do a lot of things to help control this panic. And that's what we're going to talk about today. And that's what we're going to learn. Next, please. So if you think about panic or anxiety, everyone reacts differently to different situations. Some people react to stressful situations normally. They're calm. Some people don't care about things or less care about things, whereas some even normally worry about things every second, every time, every day. So everybody's personality is different. Some people get anxious on every single item, even normally, and some can handle stresses normally, and some makes other more stressful. So there is a difference in everybody's personality, everybody's structure, everybody's anxiety level, and that's how they act. How we respond to this outbreak can depend on our background, what we do, what we see, who we talk to, and in the community we live in. A lot of times there is another phenomena which is sort of called the contagion phenomena, that if you live with people who are more anxious, if you talk to people who are more anxious, we tend to get more anxious, more panicky, and more afraid. So we need to look into all those things, and again, we will talk about it as it goes. Next, please. So, next, please. So how do we reduce panic and anxiety in our day-to-day life? So first, we need to think about that. Few common things which we need to do. Everybody talks about media. A lot of times people only blame the media, that they are increasing the panic, they are causing the anxiety. And maybe to some extent it is true. But remember, modern day media, the media which we have today, does not read the news. It uses emotions. They use emotion to elicit a response from their viewers. So if you're watching media on the right side or the left side, they are using different kind of emotions. That is the reason we always say that news is good. We need to know the news. We need to know the facts. But if somebody is an anxious type and you are one of those people who gets anxious and nervous very easily, maybe you need to read the media as opposed to see the media. The media you read usually has the least amount of emotions, whereas the media you see usually has the most amount of emotions. And that emotion can elicit panic in anybody. So we have to be careful about that. Second thing is social media is contributing to the panic people are feeling today. So for example, every day I myself get tons of WhatsApp messages forwarded by people. They don't check what the message is, but they keep forwarding to people. This forward button is a mess right now because people continue to do that. Because of that, a lot of information is being circulated, which is not true. And people continue to send those information without checking the facts. That causes more stress, more anxiety, and more panic. So in some ways, we ourselves contribute to this panic. We need to stop doing that. We don't need to stop anything. We don't need to forward anything without checking the facts. That's another thing which is important. Also, we need to focus on social connections. We need to do certain things. We can talk to people. People talk about self-quarantine. People talk about, oh, I'm not going to be able to see people or party or go out. You can do certain things to really connect with people. Remember, social isolation, social distancing does not mean social isolation. We use the word social distancing a lot. That doesn't mean social isolation. You can connect with people via phone, via FaceTime, via other apps. And still in this day and age, you feel very connected with that. If we are physicians, we are able to even do a lot of our physician visits by telehealth. So there's so many things one can do. So social distancing does not mean social isolation at all. And last, which increases the panic and anxiety the most, is hoarding. We all have watched videos on media, and we see long lines outside A grocery store, B grocery store, and people are lined up from 6 in the morning or gas stations and hoarding the mask and this and that. That has increased the panic and fear a lot amongst us. If we all stop hoarding and buy only what we need, that will reduce the panic. Why only what we need? Maybe for a week or two, because there is no proof, there is no inclination that the supplies would be limited because everything is coming. Grocery stores are open, so we will continue to get supplies. It's a good idea to have maybe 2 weeks supplies at home, sure, because what if you are self-quarantine or quarantine? But more than that, you don't need to because supplies continue to come. Next, please. So we need to also talk about people who would be most affected by this panic and anxiety. And usually I say there are 4 groups of people who are most affected. There are 4 groups of people who are most affected by this crisis. So first is people who have substance use problem or mental illness. So people who have substance use problem or mental illness are usually the most affected by any kind of stress. And I'll explain that a little bit later. Second group is kids. Kids are affected by any kind of crisis, and while they are affected, the way to deal with them is based on their age, and we will discuss that also. The third group is us, first responders and medical professionals. We are also very affected by these crises, and there's a lot of panic and anxiety amongst ourselves, but there's a different way to deal with it. And the last group is people who are older, maybe older than 65, and people with chronic diseases or immunocompromised. Why? Because CDC has continued to talk about the fact that they are people with high risk. We'll talk about all these groups and how to deal with them and their anxiety. Next, please. Let's first talk about people who have substance use problem or a mental illness problem. People who have pre-existing mental illness or conditions like depression and anxiety, they are the first one who are prone to get stressed. How do we know that? We know that from all other previous stresses, like for example, Harvey. During Harvey, when we provided mental health services, we noticed that 96% of patients who came to seek help for anxiety and depression were the people who had pre-existing mental health condition. So the studies have proven that if you have a pre-existing mental health condition, the chance of you getting stressed, anxious, and panicky is more during this kind of stress. So what they need to do is they need to talk to their therapist, their doctor, and maybe increase the frequency of treatment, maybe modify or adjust the medications. Maybe if they have stopped the medication, this may be a time that they need to restart the medications. The second group is people who use substances or who are addicted to certain things. Remember, a lot of people are at home right now. If they are using substances, the problem would be that a lot of people use substances to numb their feeling. And they will use more substances in this stress because they're stuck inside and not working and stressed. They will be trying to numb their stressful feelings more with substances. It is our job as a friend or a family member to focus on them and provide them as much support and see if they're not using substances and maybe not have increased their substance use. Next, please. The second group is kids. And I will divide the kids into 3 groups: kids under 5, kids over 5, and teenagers. And it will be different to deal with them based on the age. Next, please. So, general principles to talk about or how to relieve anxiety in kids. There are few general principles we have to have for sure. Of course, the first is if we are not calm ourselves, how are we going to explain the child to be calm and not be anxious? We are the role model. Kids feel the parents are the role model or their elders are the role model. So we have to be calm. We have to stay calm. Even if we are anxious, we have to try to stay calm in front of kids. We also need to listen to their concern. A lot of time we express our concerns, but we may not be able to listen to their concerns. We need to listen to their concerns and see what they have. You have to be a good listener. A lot of times what is seen today is that elders tend to blame things in front of kids and others. Oh, this is the media's fault. This is the government's fault. This is the state's fault. I don't think this is the time to blame. This is the time to be united and show calm and show some vision in front of kids. Because if we start blaming, they're not going to learn anything. They will continue to be anxious, fearful, afraid, and panicky. So please don't do that. Also, we need to pay attention to what they watch and hear. Some kids, it may not be ideal for them to watch news or minimally watch news. So you have to be very careful. Another thing is we have to be honest with our kid. There's no need to hide anything because if you hide things, they're going to find out through media, through Google, through some way or the other, through their friends. Don't hide, be honest. And lastly, we have to be available for their questions all the time. They can have a question in the middle of the night and they wake up with anxiety. So be available for them. So please remember these general principles talking to any child or anybody. Next, please. Now we're going to talk about kids who are less than 5. So to me, these are the most susceptible to long-term damage that can be caused by repeated viewing of the same stressful images. And I'll give you an example. So if we watch news on TV and we watch, for example, a hospital in New York and people lined up outside and people are in the ICU and the same image is shown 5 times on the same media, for us, it will be the same image. For kids, it is new image every time. So remember that we may be able to separate that it is the same image, media is showing it again and again. Kids who are less than 5 usually are not able to do that. So for them, you have to restrict the media because you don't want them to be stressed too much by seeing the same image again and again and thinking the same damage is happening again and again. That's something to remember very well because their brains are not able to separate the timeline. So that's one. And other thing is that 5 years or less, why do they have to watch too much news? You can explain them the circumstances, you can tell them few things, you can listen to their concerns and leave it there. They don't need to watch the news, they need to watch something more lighter than this stressful news in today's day and age. Next, please. Kids over 5, they are a lot better in many ways. They want a little bit of involvement. They want a little bit of empowerment. They also want to be involved and get some control. And that's how they feel that they are less panicked. The best thing for those kids who are over 5 is to ask them everything and see what their focus of concern is. If we are calm and we ask their concerns, it is always the best way to do it. We can also teach these kids proper ways to wash their hands, proper ways to do hygiene, proper ways to use sanitation, what to do, what not to do. These kids would even teach others these self-hygiene ways because they love that and they enjoy that. So again, if we are calm, not anxious in front of kids, they will use that. And maybe we can use even the examples of China and South Korea with people who are the age of over 5, that, these countries had this problem and now they don't have it. How did they control that? They controlled that with social distancing, not social isolation. They controlled that with proper hand hygiene, with a lot of things they did. We can use a lot of those things and prevent this outbreak. Next, please. Now comes teenagers. Teenagers can be usually part of the solution. They can help in so many ways because these days they're so connected to media, they're so connected to Google, they're so connected to devices, we are not. If they are involved, they can be creative in terms of how to help others. I have seen a lot of teenagers making even songs about coronavirus, making even songs about how to wash your hands and do that. Involve them. They can help you, and they can teach their others, meaning peers, how to do certain things. If you are a role model, you reassure them, you tell them how to be safe. They can do a lot of things on media, whether it is Twitter, whether it is Instagram, whether it is Snapchat, ways to do things because their peer are going to listen to them more so than they're going to listen to them. So involve the teenagers in the solution and make them part of the solution process. That is always very helpful, and they will be very happy with that also. Next. Now comes us, which is first responders, physicians, nurses, people who are at the front line. That is to me the trickiest part, because again, we are seeing patients who are COVID positive. We are seeing patients who are PUIs or persons under investigation. We are exposed to these patients, whether we work in the hospital, whether we work in the clinic, whether we work in the emergency rooms or the inpatient rooms, or whether we are screening these patients or their families at the front line outside. So we are having the most toughest job right now, and we have to be careful. And in a lot of areas, surgical masks, N95s, if needed, are not even available, although they are getting available every day. I think what we need to do in that situation is medical professionals and first responders need to make sure they take care of themselves first. Because if we are not able to take care of our own physical health, our own mental health, how can we help others? And again, I call it as an airplane approach, meaning when you fly, usually they tell you that in case of an emergency, please put oxygen mask on you and then use it for your child. Why? Because the theory is that if you are not able to take care of yourself, how can you take care of your loved child or another person? Same thing applies here. If we are able to take care of our own physical health, our own mental health, we will be better prepared to take care of our patients and others. Who can help us with that? Family and friend. They can help us decompress. They can help us, in terms of thanking us for our services, doing whatever they can for us. They can help us socialize without social contact. And research states that when doctors and nurses are well equipped to respond to these stresses, they can be responding to the stress in a better way than not. Next, please. Last is another tricky area, which is older people and people with chronic illness. Again, watching the news, watching the media, this is very stressful to see that people who are high risk are people over the age of 65, people who are in the nursing homes, people who are immunocompromised, because this disease has the highest mortality in those people. And if you're over the age of 80, the mortality is even higher. So what do you advise these people? Again, we need to advise these people that the best is to stay home as much as you can. No need to go out unnecessarily. Maybe the neighbors can help them in terms of helping groceries or day-to-day needs. This is the time to be a good neighbor. This is the best way to do for them. Also, they need to avoid any high-risk areas. They don't need to go to any area like a nursing home or something which is high risk. They need to have their meds in advance, maybe 2 weeks. They need to comply with their medications. And again, they need to take care of their personal health and personal hygiene. So least contact, social distancing is more important for them, and all these measures even more stressed for them as for anybody else. Next, please. Then comes the question of self-quarantine, because a lot of us have been self-quarantined because of this, because we may be a POI. And I can tell you, it is no fun, because I've had some experience. It is no fun, because when you are self-quarantined, you have to stay in one room ideally. Surely you can have media and others, but you are stuck in one room and you're not supposed to go out. Somebody's going to give you the food outside the door and all of that. But in today's day and age, a lot of things can be done. And what you can do is you can use social media, you can use internet, you can use TV, everything is there for you. Try to choose a room which has internet and TV so that you are connected. Not too much with news, but you can watch other shows these days. And listen to music, talk to people on the phone, use Facebook, use Snapchat. Whatever you do, again, like I mentioned again and again, social distancing doesn't mean social isolation. And maybe consider this as your mini vacation, which you were never hoping to. And I know that it's not as fun as it sounds like, but again, take the best use of time, rest, and hope for the best. Because again, it could have been worse. So just think about it. Next, please. So then comes after quarantine. So if you were in quarantine, now you're coming out of quarantine. What happens after quarantine? What happens after quarantine is that you have been separated from others for a long while now, maybe 7 days, maybe 2 weeks. And while you're relieved that you're not quarantined anymore, you start worrying about your loved ones. You start worrying that, have I given this infection to anybody else? That is a worry which continues there. Also, you're angry, you're frustrated that you were not able to take care of things. You feel guilty. You feel guilty that you're not able to perform work. You feel guilty you're not able to parent your kids. You feel guilty you're not able to hug them, emotionally connect with them. And you're also guilty if you have given it to somebody else, maybe your spouse or a child. That is all normal. And that is the reason it is good for all of us, especially people who are at high risk, meaning first responders, people with elderly age and immunocompromised, to still maintain social distancing even at home so that this situation never happens for any of us. Next, please. So if you think about frustrations towards media, there's a lot of frustration towards media, and people feel that a lot of people feel this is all media's fault that this is happening. But you know what? A lot of that is our fault also. Nobody is begging you to watch media. Nobody is forcing you to watch media. While media's responsibility is to deliver information, and right now their responsibility is to deliver everything as early as possible, it is also our responsibility to filter the information. If we feel stressed watching media A, media B, why do we watch it? We don't need to. It is very easy to blame media, but we need to see what is our responsibility. If we feel we are a sensitive person, we don't need to watch media. Or maybe we watch once a day, or maybe we just read the newspaper. Or if we know our spouse or family member gets anxious watching media, maybe we need to limit that. We need to also act responsible. We have to be involved in this. There's nobody who's forcing you to do that. Also, like I've said numerous times, you can read news on your phone, you can read news on a newspaper. This is all without emotion. That all is very, very helpful. So having said that, it is also media's responsibility not to sensationalize things, but they do that, unfortunately, and I don't think we can control that, but we can control our actions as much as possible. Next, please. So then people say, what is the best way to relieve anxiety, especially with the stock market? We all have our 401ks. We all have, not all, but a lot of people have money in stock market, and we know that it's plunging. What do you do? It is a very hard one because I have my own self 401k, and I know that it is going to be plunging. It is going to be low. But you know what? We don't need to look at it now, because if you look at it now, you're going to be very, very upset. You're going to be very depressed. And what will you do? You cannot do anything. What is happening is happening. But we need to look at the facts. We need to look at the history. History tells us that media, the 401k and the stocks usually rebound. It may take a year, it may take 6 months, it may take even a few years, but it usually rebounds. We have to try to stay positive. We have to try to stay optimist. And, it's easier said than done, I know that, but you don't have any other choice, because watching that is not going to help. So just leave it there, wait for some time, and then watch after maybe 6 months to a year, because hopefully we will come out of it sooner than later and things would be back to normal. Nobody knows how long it's going to take. And like the experts say, only the virus can tell us the time. We can only have some projections, but nobody knows the real time frame. Next, please. So how can we make ourselves more positive and optimistic? Again, it's very easy to say, be positive, don't be negative. So there are a few tips. First is, we need to analyze our own thoughts. A lot of times we don't give credit to our own self and don't analyze our own thoughts. If we start analyzing our own thoughts and start giving credit to our own self, that is the first step towards being optimist. Second is, we need to think about what are our strengths. What can we do to bring good to other people? For example, if your neighbor is an elderly person who needs groceries, help them. Or if your friend is immunocompromised, help them do things. Think of future. Don't think about the past. Past always brings depression. Depressed people are always past oriented, although anxious people are future oriented, but we need to control this anxiety. So always think of future. Minimize the negativity when it's realistic to do so. I mean, a lot of time negativity is normal, but we need to minimize it, because again, if we are negative, we will be depressed. We don't need to be negative. Also remember, tomorrow is another day. What has happened. We need to focus on the future. We need to give ourselves credit. We need to think of a good future, because with studies, things always, we know that things get better with time, and it will get better, and tomorrow will be hopefully a new day. Next, please. So what can we do to cope the anxiety during COVID? A lot of things we can do. I mentioned few, but I'll mention few more. We can eat healthy. We can exercise. People will say gyms are closed. There are a lot of things you can get done at home. Some people may have even treadmills and other things. Some can get dumbbells. Some can get other stuff. You can make your own home gym actually at your home. Sleep well. Avoid drugs. Avoid alcohol. Again, connect with others. Don't feel that social distancing meaning social isolation. Connect with people the way you can. You need to unwind. Take breaks. Take breaks to maybe even walk in your backyard. Maybe do things without other people and having a safe distance. Stay informed, certainly, but don't use or don't watch news too much, because too much exposure is gonna cause problems. And if you still feel that you're not doing well and you cannot cope with this anxiety, maybe this is the time for you to seek help. At Baylor, we have numerous ways to seek help through some employee relations, through other means which have been distributed by the college, and certain hospitals have their own support groups also. There are numerous ways you can seek help. Don't stop from seeking help if you feel you need help.